I'm Joe Chili, weekday morning, 7 to 9 a.m. on Buffalo's oldie station, The Big Weck. Today, joining us on Buffalo on the Rise is Dr. John Zilliox from Positive Health and Wellness Chiropractic. How are you doing today?
Good, Joe. Yourself?
Good. I'm doing very well, considering the fact that this is the kind of weather that kind of breaks people.
Absolutely.
That's right.
Absolutely.
You know, I hate to say it. It's kind of like, you know, I don't know whether we're ever going to dig out of winter. But tell us about, you know, one of the things that, you know, you get concerned about is back injuries, or the spine just about takes care of all the things in your body, I understand, right? It, you know, it generates from the spine. So I hear about spinal decompression. And this is something that's, I don't know if it's relatively new, just a few years. Spinal decompression, describe it to people. This is a non-surgical thing, right?
Correct, yes.
And describe how it works.
Well, non-surgical spinal decompression has been around a while. I've been doing it since 2007. It's non-invasive, it's very comfortable, and what it does, it's not traction. But people kind of refer to it as being traction when they're on the table, but it's not. It's all computerized, where we can target the area of a disc that's swollen, protruded or ruptured, people with stenosis and things like this. So basically what it does, it distracts the vertebrae without causing muscle contraction and sucks the disc away from the nerve. Whereas if people with a herniated disc be going for surgery and getting it cut or microdiscectomy, things like this, we're doing it non-surgically. And it's almost like if you took your boot and you stepped in mud and you went, pull that out, that's exactly what it's doing to the disc. It's retracting the disc.
You know, I had traction before, and this was, I'm sure, before spinal decompression. And I had herniated discs that I had done moving heavy furniture. Mm-hmm. And I was in a lot of pain, and they put me in traction, and the pain immediately went away. I mean, it was like I could fall asleep. Now, can people actually fall asleep during spinal decompression?
They do. It's very relaxing. Now, the difference between traction and spinal decompression is that traction is a vertebral distraction with muscle contraction.
Okay.
Spinal decompression does not contract the muscles.
And how effective is it?
Research shows 87 to 92% compared to traction 50 to 55%.
Really? So this is is it a machine?
Yes, it's a table that actually the patient is belted, has a harness, table goes back down, and it's all computerized so we can target the exact area of your problem.
Wow. All right, so what other kind of therapies do you offer besides this?
Well, we offer electroanalgesic therapy, which is therapy that helps with pain, decreases pain. We also have laser, cold laser, and class 4 laser, which produces heat, has a deeper penetration. We also utilize calmer therapy, which is actually a nerve scrambler. And that's used for people who have, for example, chronic regional pain syndrome. They can't take medication, or medication is not touching their pain. And what it does, it tricks the brain into, from a pain signal into a no pain signal. It's very effective. It's not curative, but believe me, it gets people back on track so they can enjoy their quality of life.
When you talk about laser, this, you know, hot and cold laser, this is nothing that you know, when you think of lasers, you think of burning or things like this.
Right.
This is something, is this a soothing type thing?
The difference between the cold laser and the class 4 is the class 4 produces heat. Now you could burn somebody with class 4 laser if it's not moved around, but it has a deep penetration, and its whole thing is it's anti-inflammatory. The same with the cold laser. Cold laser doesn't produce cold either, but it's anti-inflammatory. Use sports injuries and arthritis and a number of other things.
What about, you know, one of the things I hear and talk to people all the time that they complain about, because they have cell phones, they're using their thumbs to type on their cell phones, and they feel it up their arms. And oddly enough, they complain most about it at night. I don't know why. Maybe because during the day they're doing other things, at night they're laying down not thinking about it. Can you use something to help somebody with that? You know,
yeah, those are nerves that are coming out of the neck too. So coming out of the neck and going through the wrist. There's something called text neck that they have from texting with their head down like this. With their head down like that, yeah. Yes, and that's exactly what's happening. So they're compressing the spine with their head down, and consequently, people with that kind of problem, distraction, spinal distraction helps with that. Chiropractic adjustments help.
All right. What about, you talked about neuropathy and some things like this. People, maybe type 2 diabetics, have some problems with some numbness, tingling in their feet, things of this nature. And I hear regularly people will say, God, I hope it's not going to come to the fact that I'm going to have to lose a toe or something of this nature, What can you do to help that neuropathy?
We use very specific high-frequency therapy to help regenerate nerves. We use red light therapy to help with that. We use nutrition. So all these combined, where the drugs that are out there like Neurontin, gabapentin, things like this, these are all drugs that just numb the situation.
You've written a number of books. Maybe we should talk about a couple of them. You might want to show some of them here.
The book I wrote here is No More Knee Pain, and it revolves around therapies that I utilize for people who are suffering from severe osteoarthritis of the knee and possibly looking at a knee replacement. The other book I've written is on spinal decompression, the non-surgical approach to back pain, which explains how non-surgical spinal decompression works. The other one I wrote was Getting Your Life Back from Neuropathy, and explains again all the therapies that I utilize and that are available for treating neuropathy. And last but not least, being a clinical nutritionist, I wrote a book on the power of nutrition, which is really, really important, in which I utilize with patients with all these conditions.
Dr. John Zilliox from Positive Health and Wellness Chiropractic, thank you very much for joining us. And for more information and answers to your questions, contact Positive Health and Wellness by calling 716-689-3629 or go to meetdrz.com. Sponsorship and promotional consideration for the preceding segment was provided by Positive Health and Wellness. Don't forget to join all your favorite personalities, JP, Roger Christian, and me on Buffalo's oldie station, The Big Weck,